Welcome back. Well, today I am joined by Dr. Vyas, who is here on behalf of OC Eye Care. Well, Dr. Vyas, how are you today? It's nice to see you.
It's nice to see you as well. I'm doing great. How are you?
Good, good. You know, we've been busy, as I'm sure you've been busy. You've been open now, and everything is almost back on track, but we still have a ways to go, I think. But at least you're open and you're doing the work that's needed. And with that regard, tell me a little bit about OC Eye Care.
Yeah, sure. So OCI Care is a comprehensive ophthalmology practice. We take care of the whole eye, from anything from glasses prescriptions to cataract surgery to glaucoma to retina even, and diabetes, things like that. Basically everything for your eye. And we also offer some of the more latest cutting edge technology and premium services. So kind of your one-stop shop with a little bit of a weight on your premium services.
Okay, so now, is it just yourself, or do you have other surgeons that are with you?
So here it's just me. So every time you come, you see me, and I do all the surgeries here as well. And that kind of allows me to have some consistency and quality.
Exactly, exactly. Okay, good. So now a couple of things that I know you wanted to cover today, primarily is premium cataract surgery. Now, why is the word premium in front of that?
Yeah, the word premium is in front of that primarily to indicate that it's not really covered by insurance, and it's giving you something that is kind of not standard. It's giving you something extra. So that's what we mean by premium, in a sense. Yeah.
Okay, so unfortunately not covered by insurance, which is unfortunate. Is that primarily because it's new, or why would they not cover it?
That's interesting. So insurance just deems it cosmetic to not need to wear glasses. So things of that nature. However, there's proven to be many studies that have indicated that it decreases fall risk, increases the activities of daily living, independence. So lots of things that would benefit us. Unfortunately, insurances just choose to deem it as cosmetic.
Oh my goodness. Well, they need a talking to. Well, maybe the more you do, the more they'll realize that it is something that they definitely need to cover. So hopefully down the road that'll change. Now, one thing that you do offer is premium lenses. So how does that work?
Yeah, so your standard cataract surgery basically gets the opacity, the lens that's kind of cloudy, out of the way, and you would need glasses for both distance and near. However, the premium lenses, so there's one for just distance, if you just really want your distance cleared up. I actually have it here. I can show you. So this one here is the one that it clears up just distance, and it lines up in a particular orientation, and that's how it does that. And then there's a premium lens that does all distances, kind of like the natural lens. So imagine someone who's young, in their young 20s, who never needed glasses. That's kind of what that would mimic. A natural lens that can focus at all distances on its own. And that, it looks something like this. So that's
Oh.
what the we call it a multifocal lens would look like. So those are the primarily the three types of premium lenses out there.
Now, in regards to those lenses, how long does it take for you to do the surgery?
Oh, the surgery is fairly quick, about 15 minutes or so. And it's a fairly quick recovery as well. Usually the next day, even about 3 hours or so after, when the patch is off, people are seeing clearer than before. Yeah.
And is it it's a lens? What is that lens made out of?
Sure. So most lenses are made out of acrylic material. In the past, some were made out of silicone material, but we found that wasn't the most ideal for the optics, primarily for the optics, and also for potential things that can happen later on in life. So most of them are made out of acrylic now.
Oh, okay. And the eye takes them pretty well. It doesn't reject.
Yeah, it takes them exceptionally well, and there's no reaction to them. That's primarily the reason why we've studied over time. We've studied and found that the material is the best type.
Oh, that's great. That's great. Now, one other thing that you do in regards to cataract surgery is smart vision. So how does
Mhm.
smart vision work, and how does that differ from the lenses?
Yeah, so there's a lot of technology out there to assist in cataract surgery, and cataract surgery being one of the safest procedures out there, it also requires precision. And so smart vision really gives you that sort of precision, along with your pre-op calculations. It gives your surgeon the use of what we call femtosecond laser technology and wavefront optic technologies. So two things. So the femtosecond laser helps us in creating really fine-tuned, exact cuts around the eye, like on a microscopic level, using something called a femtosecond laser. And
Mm.
then the other machine called Verifeye, it basically uses light rays again to live measure the type of lens you would need, the power of lens you would need, and the exact orientation it would need to sit in the eye. And it's doing that because it's getting a live feedback, like a live reading. And
Wow.
so it's really helpful. It's really helpful, especially in patients who've had LASIK or RK or something like that that has altered the cornea. It's
Mm.
extremely helpful for us to be very accurate and make sure we can give our patients the best vision possible.
Now, is that something that you do prior to the surgery?
Which one, the Verify or
Yeah,
the Femto?
yeah.
The Verify is actually in surgery, like while we are operating. So once we take out the natural lens, the cataract, then we take a measurement to make sure that we're choosing the right lens, and then we implant that lens and check again to make sure that it's the correct power to leave you at needing no additional help.
Wow.
And then yeah, and then we close up when we're done.
That's amazing. I mean, the fact that you can do so much with the eye, and I like the fact that you can help people who have LASIK. I had that done about 15 years ago, and it's the best thing I ever did. I don't have glasses. I mean, for reading I do, but are you saying that that particular procedure that you're doing and measuring would not, especially with that one premium lens that you showed, the multifocal one, is that something that somebody who has LASIK would never have to have any glasses?
So if someone has LASIK, they kind of when they were younger, they corrected the corneal shape so that they wouldn't need any glasses for distance primarily. But
Right.
as we get older, the natural lens, which sits behind the cornea, will get cloudy and therefore will render the LASIK kind of meaningless or useless
Sure.
until you remove the lens, the cataract lens. However, because it alters the shape of the cornea when you do the LASIK, the way you heal changes, and the way the cornea sort of heals changes over time. And so you have to take that into account when it comes to cataract surgery. So the lens power changes. And so using these Verifeye machines basically helps us get live in the OR, live readings for those patients in specific. So it can be very accurate and make sure that they don't need glasses. Because those are the types of patients that want to, they want to be out of glasses. That's why they had the LASIK in the first place. So
Right.
it really helps us kind of assure our own pre-op calculations and make sure we can meet the patient's expectations.
Just amazing. I mean, it's just amazing all the things that they can do these days. So I appreciate you telling us the difference. And obviously, people can get in touch with you, and you can help explain all of this for them.
Yeah, of course.
Okay, wonderful. Well, thank you so much. I appreciate you taking the time.
Oh, thank you. It was a pleasure.
And we'll be right back after this.